Hello, everyone. I'm Dr. Marty Ross, and this is another Conversations with Marty Ross MD tonight. It's a webinar where we talk about Lyme disease, and you create these webinar with your questions. I hope I can answer most of your questions, and usually I can, but we'll see what you throw at me this evening. For those of you that are new here, the way you participate is you can listen to the questions as I read them and hear what I respond. The other way to participate is actually write a question. And the way to do that is over on the bottom of the right-hand side of the screen is a chat box that you can write your question to me. As you write that question, I ask that you only hit the enter key one time, because if you hit it multiple times trying to create paragraphs, it actually sends multiple questions to me, which gets to be very difficult for me to manage from this side. For those of you that are back here again, welcome back. And I'm glad to see you keep getting some benefit and that you keep returning. In the webinar tonight, I am creating a recording. And so tomorrow morning, somewhere around, hopefully by 9:30 in the morning, I will have sent out an email to you announcing that it is ready to see. And also it'll have information about how you view that too. In that webinar email tomorrow morning will be a link that you can also sign up for next week's webinar as well. So we have tonight's webinar, next week, and then I take a week off after that, okay? So we got two, counting the one tonight, to go. During the webinar tonight, I will be posting your questions on the screen so that those of you that are participating in the live version can actually see it. Be aware, though, that they don't show up in the recorded version, so I will wind up reading those questions so that the people listening in on the recorded version can understand what we're talking about, too. All right? So without any further ado, let's go ahead and get started here. Let's see, one more thing here. Oh, I guess he's not there. So somewhere in the middle of the night, or in the webinar, probably in that chair rack there, one of my Basenjis will wind up popping in there, and I usually get asked questions about that. So if it is, he usually goes over, maybe he's starting to roam right now. His name is Thor, okay? And I have two Basenjis that come here. There's Thor and there's Halo, his sister. So you may see some movement back there. Sorry if it distracts you, but that's where they wind up hanging out, okay? All right, so without any further ado, let's go ahead and get started here. Hello, Jim. Let's see. Thanks for these very helpful webinars. You're welcome. Does adding liposomal oregano oil or the oregano clove cinnamon oil combination improve the odds of 70 to 75% you've given for beating Bartonella with Sida, and Houttuynia? If so, by how much? It's a good question. What Jim's talking about, there's two herbs that I like to use that are antimicrobial for Bartonella. And those are herbs that I learned about from Stephen Buhner, as in Buhner herbs. And the two are Houttuynia and Sida. And it is my clinical experience that they help about 70 to 75% of people. Okay, pretty good odds. Prescription, by the way, for Bartonella tends to, if we use a couple prescription antibiotics, the odds are about 80 to 85%. Okay, so you got about a 10% difference here. At least that's what my clinical experience tells me. All right. Now, but more recently, there are some studies that came out somewhere about a little over a year ago now that showed that Bartonella has the ability to form what are known as persisters, which are hibernating forms of the germ. It's not clear if Sida and Houttuynia work on persisters. No one's done the research. We know it works on living, probably does a good job with growing Bartonella, but we don't know from laboratory experiments as to whether these are effective against persister forms of Bartonella. We do know from Johns Hopkins University experiments that got published over a year ago that Bartonella does have persisters, and based on their experiments, they've been able to show that volatile oils like cinnamon, clove, and oregano can treat those persisters as well as break apart a slime layer of biofilms that cover up the germs as well too. All right. So I have been since then periodically adding in the oregano, cinnamon, clove oil, or just pure oregano oil, along with Sida, Houttuynia. I don't know if I would. I'm trying to think of what percentage do I see. I think if we add that in, there may be about a 5% improvement chance of getting better using those. So maybe about 5%. It's still hard for me to quantify. I haven't been doing it long enough to tell for sure, but I would say maybe about 5%. Okay. All right. I hope that gives you some useful information. For those of you that are wondering, where do you get this liposomal cinnamon clove oregano oil, or you can just get liposomal oregano oil, you can actually find it. The product I like is a product that is made by a company called Doctor Inspired Formulations. And I'll show you where you can get that. So hold on here, just so I can do a quick screen share. All right, so this is my supplement store, and anyone can buy from my supplement store. These are the same supplements I use with my clients here at Marty Ross MD Healing Arts. These are the things I find effective, and so I have this website for my patients, but anyone can buy from here. Okay, so in terms of these products I was just telling you about, the company that makes them is called Doctor Inspired Formulations. And they got two products I carry. One is their oregano essentials. The other one is cinnamon clove and oregano. And either one of these can work against persisters as well as biofilm. I'm finding probably better success with the cinnamon clove and oregano one though, okay? And it's one pill 2 times a day. All right. All right, thanks for the question, Jim. Let's see. Hello, Lawrence. Let's see. Hi, Dr. Ross. I have 3 hopefully brief questions for you. So number 1, my best friend's wife was recently diagnosed with Lyme. The only thing she has changed so far is by her diet, by cutting out sugar, dairy, and gluten. She said this made her feel much worse. Any idea that would be? I honestly don't know. I will tell you, although that's a good diet, what is good for a majority of people doesn't necessarily mean it's good for each person. Okay, we're all very individual. The only hypothesis or idea that I might have is if she has a lot of excessive yeast in her, if you cut out sugar, that sometimes starts starving yeast, and so they die. And that dying of the yeast can result in a Herxheimer reaction, which is the immune system sees the dead parts and starts manufacturing more of those inflammation chemicals called cytokines. Okay, so for all of you that aren't familiar with cytokines are inflammation chemicals that are made by white blood cells when they see infections or toxins. And in the case of Lyme and Bartonella and yeast and babesia, and mold toxicity, the immune system in using those cytokines often doesn't get the problems under control. And so it eventually makes too many cytokines, and too many cytokines can give you fatigue, make you hurt all over, give you brain fog. The symptoms that we call Lyme symptoms are really excess cytokine symptoms. And killing yeast can trigger a Herx reaction, which is the immune system sees the dead body parts and makes more of those cytokines. Okay, so maybe that's what's going on. I honestly don't know for sure. I probably have to ask a lot more questions. Okay, number 2, I've been treating my Lyme with azithromycin and septin, and my AST and ALT are slightly elevated. AST of 44, ALT is 74. Is there any cause for concern here, or are those numbers acceptable? So AST and ALT, everyone, are enzymes made by the liver that if the liver is inflamed, those levels will become increased. It is true that when you're on various antibiotics, it's possible to cause some elevations of those, some low-grade inflammation. My practice, what I do in my practice is I'm okay with them becoming elevated as long as they don't go over 2 times the upper end of normal. Okay, so for instance, some labs would say that a normal AST level is anywhere from 20 to 40. So the upper end of normal is 40, and I don't want it to go over 2 times that. So I don't want it to go over 80, okay? So every lab reports a slightly different reference range on these. So I'm just giving you a hypothetical, theoretical on that, okay? If I do start seeing a lot of elevations, though, I sometimes will do things to help support the liver. And one of the things I like using to support the liver is glutathione. Glutathione is a very powerful antioxidant that the liver uses to detox things. Glutathione also is made in every one of our cells, including liver cells, to fix damage, okay? And sometimes if the liver is inflamed, it might exhaust its glutathione supplies, so you need to give it some more so it can detox better, but also so that it can knock down some of that inflammation. The product I like for that is a product made by Research Nutritionals, and it's called Trifortify, and there's an orange and a watermelon flavor. It's liposomal glutathione. And the reason that's important, liposomal is important with glutathione is just not that well absorbed out of the intestines in the stomach. And what Research Nutritionals has done is they microscopically wrap it in fat in a way that increases the absorption out of the gut. In fact, they've got good studies showing that there is marked increased absorption and that there is some very high good levels of glutathione in red blood cells, which is what they measured for the study. And so it appears that it actually does work to get good absorption, okay? And if you're to do glutathione in a situation like this, I usually would recommend that patients take that Trifortify product 1 teaspoon 1 time a day, okay? Number 3, after treating my mold for 3 months, primarily with GI detox, my mold levels are all higher, and I'm not sure why. I'm not in a moldy environment. I'm getting better health-wise from week to week and month to month, probably because of the antibiotics. Should I keep treating the mold or add something else? I don't tolerate Welchol as it gives terrible headaches and is too binding to me. Okay, so following lab testing and urine testing, following those during a mold toxin treatment can be maddening, okay? It's just maddening trying to figure out what's going on, all right? So it is true. Usually about 3 months, 4 months into a mold toxin treatment, I am going to wind up testing to see where we are. But when the levels rise, it doesn't always mean you're doing worse. And here's the crazy part of it, okay? So if you're doing better and you are seeing rising levels of mold toxins in your urine test, it may be that your kidneys are better able, as you get better, to remove those mold toxins, all right? So I wouldn't think of the kidneys as the greatest way to remove mold toxins, but they do remove some. And sometimes when you are very sick with Lyme and mold toxin illness, the kidneys are impaired in their ability to pee this stuff out. And so that initial test, you're just getting a tip of the iceberg. But if you retest as you start getting better and feeling better, they can pee out more, all right? So sometimes producing more in a urine test means you're doing better, all right? And to make that decision, you got to just look at how are you? I mean, if you're doing a lot better and you have higher levels, I probably would not overreact to it. I'd still keep using my binders, and I would go back in and check in a few months again, okay? All right. On the other hand, sometimes increased mold toxin levels, if it's across the board, could mean that you are colonized, that when you were in a building that had a lot of mold toxins in it before, you were also in a building that had mold in it, okay? And so sometimes we breathe in the mold spores from the environment and they colonize our nose passages and they colonize our stomach, not in a way that like you're going to have drainage of pussy mold out of your nose, but enough that you got some germs living there and they can produce toxins, all right? You become your own toxin brew pub. However, if you really are doing better, even the chances of that happening are quite small, okay? So based just on what you wrote here, I'd ask you a lot more questions if you were a person in my practice to help figure this out. But the point I'm trying to raise is sometimes if you're feeling better, but your mold toxin study looks worse, it just may mean that your kidneys are able to pee the stuff out better than what they were able to before, okay? All right. And let's see. I would talk this over with your physician, but I probably would keep treating for the mold toxins. But again, in terms of making a set decision about what you should do, talk it over with your physician, okay? All right. Good luck to you, Lawrence. Hello, Nacy. Let's see. Does the Lyme rash occur at the exact place of the bite? Is it ever itchy? I've had Lyme for over 2 years. Last week, a big red rash appeared on my arm. Not a bullseye, but a red circular bigger than the size of a quarter. Very itchy with what looks like some bite in the crater. I'm in Northern Virginia, wondering if I got reinfected. On a different note, have you seen liver damage from fluconazole, and can it help with Bartonella? Okay, let me try to answer your rash question first. So it is possible when you have an acute bite that you will get a bullseye at the place of the bite, but that also further at more distance locations, you can have bullseyes too. That is possible with an acute bite, all right? Keep in mind that all rashes that you get that look like you have a bite in the middle may not necessarily be from a tick. I mean, mosquitoes can give you red rashes. Other bugs that bite you can give red rashes too, all right? What you might do with that is if you took a picture, you might send it to your physician, just have them take a look at it with you to see if they think it's a type of rash that could be consistent with a tick bite or not. I can't tell by the description you're giving here, okay? Typically, though, it is my experience that typically the bullseye rashes or Lyme rashes are not itchy. Itchy usually means you're probably making histamines, in which case that might have been a mosquito or something that bit you that has something that's causing a minor allergic reaction at that site. Okay, all right. All right. And then in terms of fluconazole and liver damage and Bartonella. So fluconazole, everyone, is medicine that we routinely use to treat yeast. It's in a family of antibiotics called the azoles. And the ones that treat yeast and funguses are fluconazole, which is diflucan, itraconazole, which is sporanax, ketoconazole, and something called voriconazole. Okay, those are ones that all can treat fungus and yeast. In addition, in that family is tinidazole and metronidazole. Metronidazole is flagyl. And those two antibiotics we can use in the world of Lyme disease to treat the cyst form of Lyme, all right? Now, they're all in the same family. So maybe, although no one's done studies, maybe the fluconazole can actually be effective against cyst Lyme. And sometimes I use it that way. I don't have solid science showing it works, but I know people get better, okay? All right. Now, in terms of using fluconazole, when I was in medical school decades ago, it has been decades. But anyhow, when I was in medical school, we were given the fear of God about using fluconazole. We were told never use more than 1 or 2 pills. You'll inflame the liver. And we were told all this horrid stuff that can happen. And so when I first started using fluconazole to treat yeast, I mean, my regimen usually is to couple it with nystatin. And nystatin, I would do 2 pills twice a day. And then I would do fluconazole daily for a month. For 1 month, okay? That was how I originally started doing it. And I learned to treat intestinal yeast overgrowth from a physician named Jacob Teitelbaum. Some of you may be aware of him as a physician that kind of pioneered the treatment of chronic fatigue syndrome in this country. So Jacob, when he first taught me how to do fluconazole nystatin that way, I thought, okay, that's interesting. But I was taught to be scared of fluconazole. So what I did, this is back in the early 2000s, I started, when I put people on fluconazole, I decided to do liver testing every week that I had somebody on it for that full 4 weeks. And I tested the AST and ALT liver enzymes. And you know what? I never saw one elevation. And I did it religiously that whole first year. I mean, I was scared of the drug. I tested everybody's AST and ALT, all right? And I never saw one elevation at all. Now, in theory, it could happen, but I still to date have never had anyone that has developed problems with their liver while being on fluconazole. And I use a lot of it in terms of treating for intestinal yeast overgrowth. Okay, so can it? Theory, yes. Does it? I haven't seen it. And I've been using it this way since early 2000, probably 2000. I trained with Jacob Teitelbaum in about 2001 or 2002. So I've been doing it since that time, okay? And so I just haven't seen any problems with it at all, all right? All right, now, in terms of can it treat BART, it's a very interesting question. So many of you know I keep talking about Dr. Ying Zhang's lab at Johns Hopkins University, where we're learning some interesting things about how to treat persisters and persister Bartonella, as well as persister Lyme. And Dr. Zhang is just doing some really novel research there, right? But one of the studies he did, it's over a year now, he looked at what the killing potential for growing and persister forms of Bartonella. And in his study, he used a representative member of various drug families. So for instance, for the tetracyclines, he used doxycycline, but he did not study tetracycline or minocycline. And for the macrolides, which are clarithromycin, which is Biaxin, and azithromycin, which is Zithromax, he only used azithromycin. And for the rifamycins, he used rifampin, but didn't, for the rifamycins, he used rifampin, but didn't use rifabutin, for instance, okay? So he used one representative family, all right? And in his study, he showed that in terms of persisters, that clotrimazole, which is a topical antifungal, all right? It's traditionally made as part of antifungus creams, Jockich creams that we use, all right? But it's in the same family. It's an azole. See how it ends in clotrimazole, fluconazole, itraconazole, voriconazole. They're all in the same family, all right? So his study only looked at clotrimazole, but it does raise a question. Maybe other azoles will work, all right? So I know that there are some pharmacies like Hopkinton Pharmacy and Hopkinton, Massachusetts, which does a lot of good compounding work for alternative treatments on things, has come up with their compounded version of clotrimazole. I occasionally have started using fluconazole to see if it would help my patients with Bartonella, based on the idea that if clotrimazole works on a Petri dish experiment, maybe fluconazole will work in a living person. And it's not as expensive as having somebody compound up clotrimazole, all right? So could it work for Bartonella? Maybe. I don't have enough of a track record using it yet to know for sure, okay? All right. Thanks for that question. Good luck to you. Hello, Crystal. Yeah, Dr. Ross. How was your day? It was a good day. Thank you very much. We're getting hot here in Seattle. It's in the 90s today, and we've got smoke coming in from the other side of the Cascades now, unfortunately. But beyond that, it's been a good day. Thank you. Let's see here. My recent thyroid labs showed high free T3, low free T4. I was told that it was called pooling, meaning free T3 isn't making it well into the cells and instead is hanging out in the blood. Originally, 90 milligrams of desiccated thyroid was prescribed as part of my Lyme and co-infection protocol. The dose remained constant the past 3 years. To address the pooling, I was taken off desiccated thyroid and switched to Cytomel with the hope the T3 would be pushed into my cells. I wasn't given an explanation as to why pooling was happening. However, online it says the cause of pooling in most hypothyroid patients is often inadequate levels of cortisol, followed by too low cortisol and even high, which will need to be discovered and treated. The same website suggests the best test is saliva cortisol, measuring what is available and unbound. Have you seen pooling corrected by addressing inadequate levels of cortisol? Do you think saliva tests are necessary? Thanks, Crystal. All right. So let me just kind of have a discussion here, because I'm not sure that I agree with what your other physician said, although it's possible. So let's talk about thyroid first. Okay, so your thyroid gland, which sits up here in your neck, makes two kinds of thyroid. Human thyroid glands make about roughly 90% T4, and they make 10% T3, okay? T4 and T3, the differences between those two, there's two. Number one, T4 has 4 pieces of iodine on it, and T3 has how many pieces of iodine? 3. Okay, that's why we call them T3 and T4. Okay, they have just different amounts of iodine on them. All right. So one of the differences between the two of them is what's it made of. Okay. Number two, T4 is not active. All right. So T4 in the cells and in our tissues has to be converted inside the cells and inside the tissues into T3. All right. And so inside of the cells, that all is converted over to T3, and it's T3 inside the cells that makes us run, that sets our metabolism. All right. We do not have a good way of measuring T3 in the cells. It is true when we measure a blood level of T3, some of the T3 that's in the blood is from what your thyroid makes, and some of the T3 that's inside of your cells that leaks back out into the blood, all right? But what's going on in the blood may not always accurately reflect your T3 status inside of your cells, all right? Okay? All right, now, part of the problem with why you may have high T3 may have nothing to do with pooling. It may have to do with taking the desiccated thyroid. So desiccated thyroid, which is thyroid that comes from pork, ground up pork thyroid gland, is higher in T3 than what our thyroid is. Okay, remember I said ours is about a 90%, 10% split. And I'd have to look at this more. I can't remember exactly, but I think that desiccated thyroid may be an 80% T4, 20% T3 split. Okay, so one of the reasons that you may be having higher levels of T3 is you're putting too much in your blood. The desiccated thyroid may have a lot more than you relatively need. Okay, all right. Now, to get an idea, though, if that T4 that you're taking, whether your thyroid makes or is in the desiccated thyroid, is being adequately converted over into T3, there's a way we can look at that. Remember I said we can't really measure what happens with T3 in the cells, all right? But we can measure another product called reverse T3. And what happens with your T4 has got two choices. It can either be converted into T3, becomes T3, okay? Or it can be shunted over and becomes something called reverse T3. All right. So T4 is either going to become T3, which is the active stuff in your cells, which we can't really measure well in your cells, okay? Or it can be shunted over if the body thinks there's enough T3 in the cells. This reverse T3 will develop, and that we can measure, all right? So one way to figure out if you're really not getting enough T3 in your cells would be to go ahead and measure reverse T3. If your reverse T3 is high, that suggests you're not getting enough conversion of T4 to T3 in your cells, okay? And that would be something to consider as well, too, okay? Now, one last thing. It's true. Your thyroid is, your ability for your cells to convert T4 to T3 is going to be helped by cortisol and be helped by adequate levels of adrenal support. So there are different ways of measuring how your adrenals are doing. You could do saliva testing. You could also do blood testing. Blood testing gives you probably more accurate. Blood testing can be reproduced better. Saliva test, if you do it, there's some quality issues. In fact, saliva test samples have been sent to one saliva lab and then to another saliva lab, and the results are compared, and often they vary quite a bit. There's not a lot of consistency among those labs, okay? All right. What would I do in a situation like this? Well, first of all, I would probably have gotten you off of the desiccated thyroid, and I might have just used T4 by itself. I might have done something called levothyroxine, which is just pure T4, okay? Because clearly you're getting too much T3, and that too much T3 may be suppressing the signals from your brain for your brain to send out signals to the thyroid to make adequate amounts of T4, all right? Your testing tells me you have too much T3 relative to T4. It may have nothing to do with pooling. It may have to do with the form of thyroid that you're getting, okay? So I would have converted you over to a comparable level of T4, and then I would have retested. As part of that testing, I also would have measured a reverse T3 level as well, too. And in my patients that have thyroid issues, I routinely will put them on adrenal support to help the thyroid work better. And to do that, I like working with something called ashwagandha. Ashwagandha is an herbal medicine that has been used for thousands of years in Chinese medicine and in East Indian Ayurvedic medicine because it's been shown to give better energy to people. And if we look at animal models, studies of those, it shows improved thyroid function and improved adrenal function when you do that, okay? And then if you were to want to get more accurate measurements of what's happening with your adrenals, my preference actually is a fasting cortisol level first thing in the morning. It's a very reproducible, accurate test, but saliva testing may give you some input on that as well too. Okay, all right. Good luck to you, Crystal. Let me show you my article on thyroid where you can read a little bit more about this too. And I think I may even have the ratios in there too. Let's look at it together here. So I'm going to do a quick screen share. All right, so this is Treat Lyme by Marty Ross MD. I think many of you know this is my Lyme disease information site. And so take a look at my section on hormones here. Where is it? Here it is. Okay, and this is an article about low thyroid that I wrote to my medical board a number of years ago when they were challenging how I manage thyroid illness. So this is what I wrote to them. Okay, so it actually worked. I didn't stay in trouble with them after they read through this. So anyhow, it talks about thyroid. It talks about the various ways that people manage it. But I'm just trying to see if I wrote in here. Yeah, here we go. Okay. So here's a section where I describe the types of thyroid medication that you can get, okay? And let's see. Okay, so desiccated thyroid does contain higher amounts of T3 relative to T4, okay? And the ratio of T4 to T3 and desiccated thyroid is 4.2 T4 to 1 T3. All right, versus our normal thyroid gland makes 14 parts of T4 to 1 part T3. So in fact, it's even worse than what I was describing earlier. That desiccated thyroid is very heavy T3, which is why you may have been having higher levels being measured. It may have nothing to do with pooling. Okay, all right. All right. Good luck to you, Crystal. Oops. Let's see. Hi, Lynn. Let's see. Do you have recommendations for tick spray that doesn't include DEET or other potentially dangerous chemicals? Yes, I do, because I've been looking into that. So there's a... So in terms of doing tick control, there's two things you can do. Number one, on your clothing and on tents and things like that, you can spray them and let it dry on a chemical which is called permethrin, right? And you literally have to get them wet and let it dry. Most permethrin products, you can then wash that clothing item up to about 4 or 5 times per treatment, and it will still be active. Okay, so that's a tick. It actually permethrin can kill ticks and other insects that come in contact with your clothing. Okay, all right. All right. Then the other thing you can use that is a DEET alternative. So DEET is an insecticide that you put on your skin. All right. The trouble is DEET has some abnormal influences on our neurologic tissues. It's a neurotoxin, all right? So there's another product you can use, which is called picaridin, I believe. I'll show you it here in a minute. That is in some topicals that can work as well as the DEET does, okay? So I'm going to show you a product that you can do. In fact, I've been thinking about getting this for my store. I just haven't set it up yet, but I'll show you it. It's a product, actually, let me we'll look at it together because I want to make sure I'm saying picaridin right, actually, too. All right, let's see. So I can do a screen share here. Okay, so let's do this. The company that makes this product, one of the companies that makes it, is called Ranger Ready. Okay, yep, this is them, okay? All right, and this is the product I was telling you about, that's your DEET alternative. It's called picaridin, okay? And then they also talk about permethrin, and they have products that have both of those, okay? So permethrin is what you would put on your clothing, but you need to let it dry on. Picaridin containing products would be what you would wind up putting on your skin, okay? All right. All right. Good luck to you, Lynn. Hello, Dave. Hi, Dr. Ross. I've been taking thorn curcumin for roughly 2 months, 1 pill 3 times a day, and glutathione 1 time a day. I really haven't seen any major improvement. Still feeling crappy and fatigued. Currently treating Babesia with Zithromax and Malarone. Do you think I should increase curcumin to 2 pills 3 times a day, as you have previously recommended? Any side effects from taking this higher dose of curcumin? Thanks. All right, so a couple things here. So I'm going to make a couple points, okay? And it would really be good if I could ask you tons of questions, which I know we can't in this kind of forum. So I would want to ask you a lot of things to try to figure out why you're still fatigued after and not getting better after 2 months of treating Babesia and trying to manage your cytokines, all right? So it's true, yes. I mean, increased cytokines can be one of your causes of fatigue and symptoms. You could give a try of increasing the curcumin up to 1,000 milligrams 3 times a day. If it is going to make a difference, you should notice it within a week or two. And if it's not, I would probably just decrease it back down to the 1 pill 3 times a day. Okay. Now, keep in mind, you're managing cytokines for 2 reasons. Okay. Number one, lowering cytokines helps your symptoms. Okay. It can help your brain work better, gives you less brain fog, may take some of your pain away, and may even help improve your energy, improve your sleep, etc. Okay. So you're using it to manage symptoms. The other reason you're lowering cytokines, though, even if you don't see a symptom change, is lowering cytokines helps your immune system work better. All right, so excess cytokines can actually impair your immune system too. So even if you're not feeling much from it, I still make it an essential part of my treatments, okay? All right, but again, bump it up for a couple of weeks, see if it makes a difference, okay? Okay. The other observation I want to make, Dave, is when you're treating for Babesia, if you are on the right treatment for your Babesia, or if you are on an effective treatment for your Babesia, by 2 months into that treatment, you should be starting to see a lifting of some of the Babesia symptoms. Now, I didn't say the Babesia symptoms would be all gone, but you should be starting to see some lifting of those Babesia symptoms. Okay, so what are Babesia symptoms? Well, fatigue is one, but Lyme can give you fatigue and other things can give you fatigue, but fatigue is one of those things to look at, okay? Other big symptoms that make you think about Babesia are night sweats, air hunger, anxiety and panic attacks, headaches in the front of your head, migraine headaches. Babesia rarely, and some people gives a strange symptom, which is it gives them a frequent deja vu experiences, all right? So you would look kind of at all those symptoms and you would say, before I began my Malarone and my, I think you said Zithromax here, before I began my Malarone and Zithromax, what was going on with air hunger, fatigue, headaches, night sweats, anxiety, panic attacks, and deja vu. All right. And then now you look and say, what's going on with all those symptoms again? If all of them are not getting any better, I would come back and rethink about, is this an effective treatment for your Babesia? It isn't always. Sometimes we have to change to a different agent, okay? So I would take a look at that and should discuss that over with your physician as well too, okay? The other things that can affect fatigue that may not change too unless you're addressing them is, number one, sleep. You need to get 7 to 9 hours of sleep. And sometimes that can be helped just by lowering cytokines. Sometimes we have to take other measures to do that. Number two, sometimes it's very helpful to support the adrenal glands and to use an adaptogen like the ashwagandha, okay? And then finally, the other thing to not finally, but the other thing is to look at is make sure your thyroid and your adrenals are regulated. Your physician should be helping you with that. And then finally, often people with chronic Lyme from having been on antibiotics or from having immune suppression can develop too many yeast living in the intestines, and that can fatigue you. So you want to take a look and see, could that be a problem too, okay? So let me give you some resources you can look at, because you may want to discuss some of these ideas with your physician as well, okay? So I'm going to do a quick screen share here. All right, so this is back at my Lyme information site. This is my treatment protocol here. I call it the Ross Lyme Support Protocol, okay? At least I'm trying to get it there. There we are. All right, so it addresses the key areas that are going to help you feel better and get your immune system working, okay? And so number one, get sleep. That's what I was just telling you about, okay? And I give you some ideas on how to go about doing that here. Number two, I didn't mention it, but sometimes being on a paleo type diet can help, and I talk about that up here. Number three, lower cytokines. That's what you and I were just talking about. Number four, being on an adaptogen, something that helps your hormonal systems work better. That's the ashwagandha that I was just mentioning. Multivitamins sometimes can help. Doing some basic detox work can sometimes help. But the other big thing is getting yeast out. Okay, so how do you know if you have a yeast problem? Take a look at this questionnaire that I got here somewhere, right here. Fill out this questionnaire, yeast screening questionnaire. All right, just got to fill this out. If you score on this questionnaire at 140 points or higher, there is a good likelihood that treating for too many intestinal yeast can make a difference for you. Okay, all right. All right. All right, Dave, good luck to you. Hello, Kate. Let's see. Hi, Dr. Ross. I tested positive in blood with an IgG to strongyloides and was treated with 2 doses of ivermectin over the course of 2 weeks. Is that sufficient treatment? Also, I'm in remission from Lyme, but ever since my IgE is elevated, and I think it's due to, leaky gut and antigens passing out to the bloodstream. Thoughts on this? Okay. So first of all, off the top of my head, I don't know what the ideal treatment is for strongyloides. I would have to look it up. I just don't know. So I can't make a comment as to whether 2 doses of ivermectin was sufficient for that or not. I honestly don't know. A lot of stuff I know, but sometimes I have to look things up, and I actually don't have the resources right here to do it while we're in the middle of a webinar. Okay, all right. All right, then in terms of your IgE being elevated, so IgEs are an antibody, a group of antibodies that we develop, okay? So, and it is a type of antibody that can be elevated when we are allergic to things, okay? A common cause of IgE being elevated is parasites in the intestine. All right, so you gotta wonder with your strongyloides, all right? So did you get rid of the strongyloides, all right? But the other thing that can lead to it being elevated is if you've got leaky gut, leading to things that you're allergic working their way through the gut lining to your immune cells that line the intestines, triggering IgE, all right? So let me describe that to you real quickly. So in terms of leaky gut, I'm going to describe the anatomy of the intestines, okay? So you got the inside of the intestines, and then you have one layer of cells. You got the inside of the intestines, one layer of cells, and then under this one layer of intestinal cells, you've got your blood vessels that run, and you got in between the blood vessels and this layer of cells, you've got 60 to 70% of the body's immune cells right here. This is where the body's immune system sits. 60 to 70% sit underneath the intestinal cells and protect things that we don't want to get through into the blood system from getting there. Okay, now in normal functioning intestines, these cells touch up against each other very tight with no gaps. All right, now, and then what happens in normal functioning intestines is this stuff that's in the middle of your intestines, some of it's poop, some of it's undigested food, some of it's toxins, etc. Okay? What happens is healthy bacteria that lines your intestinal tract does micro-digestion of the food particles and breaks peas and corn and beef into their individual amino acids and sugars and fats that cannot be identified as being from corn and being from peas and being from beef, okay? And those microscopic particles get absorbed into these cells, and they pass through these cells, through the immune cells, which doesn't recognize them as foreign because they're microparticles, and they get into the bloodstream, all right? Now, if you get an infection like a parasite infection or too many yeast living on your intestines, these cells plump up and pull apart. Now you got gaps. And guess what stuff can leak through and hit? All these immune cells sitting down here, okay? The immune cells that make IgE, for instance, all right? And so you start getting partially digested food that gets through. So parts of corn, microscopic parts of corn, microscopic parts of peas, microscopic parts of beef, gluten. That stuff comes through, and because it's not micro-digested, it gets recognized by these immune cells as being a foreign piece of corn or a foreign piece of gluten. And guess what they make? IgEs, okay? So one of the things you want to do is look at, not only to make IgEs, they make cytokines, they make a bunch of inflammatory chemicals as well too. You have allergic reaction, okay? They release histamines into your bloodstream too. So if you've got elevated IgEs, I like to look at the gut. And there's two things I'd like to look at. Number one, do you still have a parasite infection? Okay. Number two, do you have too many yeast in your intestines? And I already showed you the tool I like to use to figure out if people have too many yeast. If you do have too many yeast, treat for it. It might be enough to allow your gut to start healing so that you don't keep having leaky gut and you stop making IgE. All right. Now, whenever you have an infection that leads to the leaky gut, like you have too many yeast or you have parasite infections, keep in mind, even when you remove the intruders, those yeast and the parasites, that it can sometimes still take about 6 months or so for your gut to heal, so you don't have any more gaps here. So you got to give it time to correct itself as well, too. Okay? All right. Good luck to you, Kate. Hello, Alex. Hello, Dr. Ross. A few questions for you. Are vision eye floaters more associated with Lyme, Bartonella, or Babesia, and how do you get rid of them? All right, I'll start with one question at a time. Okay, so for the eye floaters, I tend to see them more as a Lyme-related issue. I don't tend to see them at all as a Babesia-related issue. There's a question I have as to whether Bartonella may be or not, okay, but definitely Lyme. There is no specific treatment for them. In other words, there is not an anti-floater medication you put in the eyeball. There's not an anti-floater pill that you take, okay? The treatment is get rid of your Lyme and do all the things that you can to deal with Lyme, the symptoms of Lyme, like being on the ashwagandha I've talked about, being on your anti-cytokine agents, getting yeast out, correct the underlying problems that cause the floaters, okay? All right. Let's see. Also, is there a cytokine test that you can measure your levels to see if they are elevated and experience a flare-up? And then lastly, can Lyme, Babesia, and Bartonella increase cholesterol and glucose levels? Okay, so in terms of cytokine measurements, there are some labs that do cytokine levels, but it's still unclear how they really correspond with activity of Lyme. I mean, we all talk about that when you have Lyme, you have increased cytokines. What's not clear is what's the pattern of elevation that you see, which specific cytokines are always elevated in Lyme. The other thing is cytokine testing is still not a perfect test, so I don't use it. I don't usually get any meaningful information out of it. Interestingly enough, as I've been reading about post-COVID syndrome, one of the labs that has been doing some work in this is out in California, and they are now claiming that they have a cytokine profile test that if you have an elevation of certain kind of cytokines, that is indicative of having post-COVID syndrome. Now, it's experimental, but I just throw that out that, yeah, I mean, there's some companies that are looking for what is the chemical markers that would tell you, metabolite, inflammation markers that would tell you if something is active, whether it's Lyme or whether it's post-COVID, long haul syndrome. What is it? What are the chemical makeup markers that can tell us that you have this? Okay. And I know in the world of Lyme, there's some hope that maybe someday we'll have a chemical profile test that you can take that tells you Lyme is in you, and we won't have to rely on immune markers, and we won't have to rely upon T-cell test or antibody test to say that that you've had the germ. Okay. All right. All right. Then lastly, can Lyme, Babesia, and Bartonella increase your cholesterol and glucose levels? I haven't seen them to do that on any kind of regular basis. So I would say probably not. Okay. All right. Good luck to you, Alex. Hello, LM. Dr. Ross, are you taking new patients into your practice now? The answer is yes, but with some clear restrictions. And that's so I'll just describe them briefly. And I know this may sound crazy given that COVID is raging out there, but to meet requirements of my medical board and medical boards in every state in this United States of America, I am starting to for new patients, I will have to see you in person in my office to establish care. All right. And then for Washington State residents, I am doing visits both after that first visit. There's the option of doing telemedicine, but about every 4 months, I will want to see you in person. For non-Washington State residents that are U.S. citizens, I am going to be requiring that every visit be in office. And the reason is that post-pandemic, most states are no longer allowing us to do a telemedicine of their citizens without having licensure in their state. So therefore, I am requiring that people come out and have visits with me in office, okay? At this point, for my Canadian patients and people that are international, I am doing those all as telemedicine visits because they can't get into the United States to see me. So those people I am actually doing new visits without the requirement of an in-office visit at this point. Okay. All right. So anyhow, I can show you where you can look at that. I'll just do a quick screen share so you can take a look at this. There's quite a bit of information about forms you would need to fill out and cost, etc. So let me just do a quick screen share on that one. All right, so my practice website is at martyrossmd.com. All right, and to read information about the requirements that I have to be a person up in my practice, take a look at my appointments page. And I'll just point this out. New patients must see Dr. Ross in office for the first visit. Okay. I had a person try to book today that just blew by that completely. It has to be in office. All right. And then down here, I talk more about specifically who qualifies, what about international patients, visit frequencies, the visit length, cost, how I work with insurance. And then down here is the forms that you would need to fill out to become a practice patient. Okay. All right. So read through all that. That probably answers most questions many of you might have. Okay. All right. All right. Good luck, Ellen. Hello, Janet. Let's see. I recently had major back surgery and now seem to be having a resurgence of Lyme symptoms. Can anesthesia and or surgery cause dormant Lyme to be reemerge? I was treated for Lyme and 3 co-infections with a Lyme ND for 7 years and have been feeling pretty good since 2014. All right. So, Janet, there's a couple things I would think about just based on your story. And again, it's just what you wrote here. I don't have the full picture, obviously, because it's a brief statement that you made. Okay. Number one, so to answer your question, yeah, general anesthesia can allow for Lyme to get active. if it's still in you, okay? So, and we don't know why, but it's a common finding that most of us see is that general anesthesia, and by general anesthesia, I mean you're in an operating room, there is an anesthesiologist who puts a breathing tube down your throat and you breathe in anesthetic gas, okay? That's different than a dentist office where you may breathe in nitrogen or nitrous. That is not general anesthesia, okay? And that is different than something called conscious sedation, where you're not put in a breathing tube, but they give you medicine that makes you sleepy through your vein for some of the procedures that people do, okay? So, but general anesthesia, where they knock you out, put a breathing tube in, and you breathe anesthetic gas, that kind of anesthesia sometimes does allow for Lyme if it is in you to get active, okay? All right, so that's one option, all right? But the other option that I would look at strongly in you before you go down the rabbit hole of treating Lyme again, because we all know how complicated that can be, is I would want to make sure that it's that having had surgery, probably having gotten some antibiotics as part of that procedure, that it did not trigger too many yeast to live in your intestines, all right? And you're probably thinking, what the hell does that have to do with how crappy I feel? Well, let's talk about that, all right? So when you get too many yeast living in your intestines, guess what they trigger? Cytokines, all right? And as you know tonight, and I talk about all the time in my webinars, when you feel terrible in Lyme, the big reason you feel terrible in Lyme is your immune system overproducing cytokines. And if you get too many yeast in your intestines, guess what the immune system overproduces? Cytokines. And that can even result in you getting joint pain and joint stiffness as those cytokines go out throughout the body and lead to inflammation everywhere. It can lead to brain fog. It can lead to body pain everywhere. It can lead to sleep disturbances, just like Lyme can, okay? In fact, in my practice, when I see that somebody has been doing well for a few years, 2 years or so, and suddenly they show up at my doorstep and they say, I think my Lyme is back. And I mean, I have people do that quite often, right? Well, not quite often, but often enough. And so the first thing I like to sit down and just take a yeast history from them and find out, is there a possibility of yeast? Because I know in my practice, 80 to 90% of the time that somebody gets worse after they've been doing better, it's yeast. That's what I see, okay? In other words, 80 to 90% of those people, I throw in a yeast treatment, and guess what? By the time they see me 30 days later, most of them are better. It's just the way it is, okay? So what things make you think about yeast? Well, number one, if they gave you antibiotics, they probably did with general surgery, you're set up to get too many yeast in your intestines. Also, having had been on antibiotics, even if they were herbal antibiotics with your naturopathic doctor, you're still set up to get too many yeast in your intestines, all right? And that can even occur years down the road. In addition, I would look to see prior to surgery where you're having a lot of gassiness and bloating, where you're starting to have recurrent yeast infections vaginally, were you noticing that if you had something sugary that you started having a lot of inflammation in your joints? If you had something sugary, did you notice you felt worse overall? Are you having sugar cravings? Were you having sugar cravings? Okay. And then the big sign, sometimes the only sign sometimes you see is that people with too many yeast in the intestines sometimes develop a lot of pimples and acne. Okay. And the relationship is when you start making too many yeast in the intestines, they release toxins. They trigger all those cytokines I talked about too, but they also release toxins. And those toxins in people that have a genetic predisposition go to the skin, triggering pimples and acne. Okay. So anyhow, I would take a look and consider with your physician, based on what I was just saying here, is this yeast? All right. Before jumping down to necessarily say this is Lyme. Okay. All right. Good luck to you, Janet. Hello, Justin. Let's see. Are any of these infections associated with keratosis pilaris? Any suggestions for improving the symptom? Also, any information on ocular involvement? It's just so difficult to determine if the immune suppression is reactivating shingles and other viruses. Thank you. So, Justin, in terms of keratosis pilaris, I don't think of the tick-borne illness as necessarily being related. But anything that is skin related, again, if you've got tick-borne illnesses and you've been on antibiotics, there's a chance of triggering too many yeast in the intestines. Skin issues get worse with too many yeast in the intestines. It's as a systemic reaction to the yeast in the intestines, okay? Let's see. In terms of ocular involvement, I would need to know more what kind of ocular symptoms you're having. It's hard for me to answer that based on what you wrote here, okay? All right. Good luck to you, Justin. Hello, Brandy. Hold on here just a minute, Brandy. All right, let's see. Muscle weakness and crackling in the neck where the occipital lymph reside, making it feel as though my neck is not strong enough to hold up another weight of my head, almost like an ALS symptom. Do you have any information on that symptom? It often runs down to the trapezoid and can even be red, inflamed in the skin, almost like psoriatic arthritis. Thank you. I don't know that I have a specific answer for that. What I can tell you is this, though. What I know is that often people with Lyme will describe, and this is Lyme, not Bartonella, not Babesia, not Ehrlichia, not Anaplasma, not mold toxin illness, Lyme, okay, the Lyme infection, will describe a lot of pain here at the base of the skull. Often they'll have a lot of cracking and popping of the neck as well, too. That is a Lyme symptom. Why it locates right to that place, I don't know. I haven't seen a decent explanation of it, but this is a common place that people can have Lyme-related symptom of pain in that area. Okay, all right. Good luck to you. What do you do about it? Well, you treat the underlying infection. Okay, magnesium sometimes can help, and also being on anti-cytokine agents can make a difference as well. Okay, all right. Good luck to you, Randy. Hello, Thomas. Let's see. Do you recommend any of the immune modulating mushrooms that are often found in host defense? Or how about ashwagandha or astragalus or licorice? Some say they're great, and others say they're too hard on the adrenals. Appreciate it. I do like to support the immune system, okay? But I think there are stronger ways to do it than working with mushrooms and licorice. So first of all, I like to support the adrenals. And to do that, ashwagandha. All right, so I do use ashwagandha, but I'm using it as an adrenal support, which indirectly will help the immune system, okay? The other key parts of the Ross Lyme support protocol are all oriented ultimately at helping the immune system. So number one, get sleep. Sleep helps your immune system do better. Number two, lower cytokines. And I showed you my protocol earlier. I'll show it to you here in a minute, but lower cytokines because excess cytokines suppress the immune system. Support the adrenals with ashwagandha, okay? Be on a good multivitamin. That supports the immune system. Work on detox. That supports the immune system. Get yeast out of the intestines because the excess cytokines created by yeast suppresses the immune system, okay? So those are all key parts about supporting the immune system without taking a direct immune system stimulant. Because I don't think that by themselves the direct immune system stimulants work. It needs to be part of a comprehensive program that's designed to support the immune system, all right? So what is that? What are they again? Let me just show you again. So this is what I build into the Ross Lyme support protocol, okay? All right, now, so you would take a look at my protocol again. All right, so the protocol is ultimately designed to support your immune system, okay? Number one, get sleep. Sleep helps your immune system. Number two, be on a good diet, something that's clean, non-toxic, that supports your immune system. Number three, lower cytokines, that supports your immune system. Number four, be on an adaptogen, which is ashwagandha, that supports your immune system, okay? Correct your hormonal problems. That supports your immune system. Be on a good multivitamin. Do some basic detox. Exercise if you can. And I know at the beginning of treatment, that's hard for a lot of people to do. But notice what I say here, my section on immune system boosters. What I say here is everything that I just talked to you about, boost your immune system. You don't necessarily need to be on immune system targeters if you do the first 8 parts of my protocol, all right? And then get yeast out. That's critical. That's how you support your immune system, okay? All right, let me go back. All right, Thomas, good luck to you. Hello, Kate. Let's see. Hi, Dr. Ross. In one of your webinars, you gave me great advice about Lyme, Bartonella, and eye symptoms such as visual snow, hazy vision, and reception issues. After parasite cleansing and upkeep of herbs, BDNF by research nutritionals, L-carnitine, others, I have made improvements, but static vision and perception issues remain. Does this directly stem from the CNS? In that case, what is the best way to get into the CNS? I'd appreciate any insight on this issue. So I don't know the actual reason people have this static vision. Okay, I don't know the mechanism behind it. Okay, it is some type of a neurologic symptom, though. And again, the big things I tend to think of, in addition to kind of corrections you made already, is infection. And the 2 infections that could be related to this would be Lyme and or Bartonella. And so I want to make sure, because I don't see that you wrote it here, that you also have done things to treat Lyme and or Bartonella. All right. Now, you could do that herbally, you could do that prescriptively. And as you look to do those, you should work with a provider that can help you pick items that do brain penetration. Okay. Those would be my thoughts on that. All right. All right. Good luck to you, Kate. Oh, one other thing, Kate. Let me see here. I got to put your question back up. So the other, I think you're probably doing it because I see you're on the L-carnitine, but you also want to do mitochondria nerve support. So carnitine can do that. You want to support the covering of your cell energy factories called mitochondria and the covering of the nerves. That would be to use ATP 360, which rebuilds the mitochondria covering and the nerve membrane covering. And you would do that as 3 pills 1 time a day. You might want to try coenzyme Q10 as part of supporting your mitochondria. And that would be 400 milligrams twice a day. And then again, if you're vegetarian, carnitine would be something critical for that. And I see that you're on that, okay? So that's my mitochondria support formula, if you will. I'll do a quick screen share so those of you that aren't familiar with it can take an article that I've written about it, all right? So hold on here. I'm going to do a screen share here. All right, so in terms of, so every one of our cells has an energy power system called mitochondria. And in chronic infections and in mold toxicity, the mitochondria membrane covering can get damaged, all right? Then you get bad energy generation and you can't heal. Similar process happens to nerve cell membranes too. So to fix that, take a look at this article here that I have called How to Fix Mitochondria and Get Energy in Lyme Disease, all right? It walks you through the steps to take on that, okay? All right. All right, good luck to you, Kate. There's another part from Kate here. Just a minute. Let's see. Is it true that visual symptoms, perception issues stem from the CNS? If so, how do you successfully get in the CNS? Oh, I think I just answered that for you. All right. Good luck to you, Kate. Hello, Alyssa. Let's see. Hello, Dr. Ross. Thank you so much for providing these informational sessions. You're welcome. Let's see. I have been battling Lyme plus many co-infections. Through this unpleasant journey, I have gone up and down with my wellness. Last year, October, time frame, my disease seemed to take a step up in intensity. I was diagnosed with POTS and mixed connective tissue disease. I was also exposed to black mold this year, and all of these put together have really made things messy for me. My disease is very neurological and has continued to make walking horrific. The way I can describe it is a zombie foot leg drop. My circulation is also very poor. I feel like giving up at times. How do I manage this awful disease and all this neuro damage issues? What is the best meds to treat this? Primarily the neuro symptoms, legs. This disease is wearing me very thin. All right. So listen, I can only make some general comments because I would need to know a bit more about you. I mean, you wrote me quite a bit, but I would need to know a lot more about you, okay? But in general, when I see this type of neurologic compromise like you're describing, I tend to think of Bartonella, possibly with Lyme mixed in, and I tend to think of mold toxicity. And I would, in my practice, I would design treatment that would focus on all of those based on this explanation that you gave here. Now, granted, I'm not your physician. I have limited information about you here, but I'm just describing what you wrote here. I would think of wanting to be on a treatment that focuses on Bartonella and Lyme, and a treatment that also works on removing mold toxins if that's what's going on with you. And in addition, I would want to do some things to support your neurologic tissue and the mitochondria. So I just talked about that. The things that support mitochondria and neurologic tissue would be the ATP 360, 3 pills 1 time a day to repair the nerve cell membrane and the mitochondrial membrane. I would want to do some glutathione, which is a very powerful antioxidant that helps your detox mechanisms, but also helps repair mitochondria and nerve cells from the inside. I like using the Tri-Fortify product by Research Nutritionals because it's liposomal and gets good absorption. I would do a teaspoonful 1 time a day. If you are vegetarian, you may not be getting enough of a chemical called carnitine, and you need carnitine to absorb fat to the inside of your mitochondria, or it can be burned into cell fuel. So you would want to supplement that if you're vegetarian, okay? And then finally, you might consider adding some coenzyme Q10, 400 milligram pill twice a day, okay? So those are things you can do to repair mitochondria, repair nerve injury, okay? In terms of treating Lyme and Bartonella, there is a treatment there's some antibiotics you can use that the same 2 antibiotics that address Lyme address Bartonella. And one option to do that would be to do something called clarithromycin coupled with rifampin. Those 2 are effective treatment for Bartonella and are very effective treatment for Lyme as well too. And so sometimes I will do that with my patients too. I would also then get on some binders to treat your mold toxins, and I would only recommend the actual binder based on what your toxin profile is. And obviously you haven't shared that with me here, so I can't say for sure, okay? And then I would also want to make sure you're getting sleep, and I would want to get you in some things that lower cytokines, like that Thorne Mariva 500 product, okay? Now, I know it looks dark and bleak to you. I know. And in fact, you're similar to a lot of people that come into my office, okay? But you can get this turned around. In fact, I was just visiting yesterday with a patient of mine that's down in Austin, Texas. Then when she came to see me 6 months ago, her husband had to practically carry her into the office. She could barely stay awake through the treatment. And had horrific body pain, could not think straight, severe fatigue, 0 out of 10 energy, okay? And yesterday when we talked, just 6 months down the road, we focused on her Lyme and her Bartonella. We did detox work. They cleaned out the mold in her house, and her energy now is up to 65%. She now is up throughout the day doing activities until about 4 p.m., and then she does slow down. And her brain's working again. And that's in 6 months. That's just focusing on all these areas at the same time and working on them, okay? So I say that not to guarantee you could have that outcome, but to at least let you know you could have that outcome, okay? So although it may look bleak and hopeless, there's still lots that can be done here to help you, okay? Oh, and she had POTS as part of it. She also had mast cell activation as part of it. And they're all better just by focusing kind of in the same areas I just described for you. That's what we've done with her. And she's doing a lot better. Okay. All right. Good luck to you. Hello, Kate. Let's see. Can you still have Lyme and co-infections without having elevated cytokines? I have a low CD57, positive Lyme bands, and clinically diagnosed with Bartonella, but my cytokines are normal, which really surprised me. Why would this be? I always thought to have symptoms, you have to have inflammation. So the problem is we don't fully have cytokine testing is not always accurate. It may not correctly measure cytokines, number one. Number two, it may not be measuring the actual types of cytokines that are created when you have Lyme. All right, so it's flawed. All right, so yeah, it's possible you could still have Lyme and have negative cytokine testing. Okay, all right. Good luck to you, Kate. Hello, Anna. Let's see. Hi, Dr. Ross. I'm currently treating Lyme and BART with 125 milligrams of disulfiram. Can't go higher without severe Herx. Pulsing azithromycin 4 days per week and rifampin daily. However, I also have 2 rickettsial infections, Rocky Mountain spotted fever and typhus, which my LMD in Canada has never talked about in the 5 years I've been seeing him. I don't think he knows how to treat rickettsial infections. Do you have any suggestions? Also, any other suggestions about Lyme and BART treatment? Should I try adding liposomal oregano or other liposomal combo? I also have mold and tape binders. All right, so first of all, I'm restricted in giving you the most accurate advice because you've written me a paragraph, and as you know, it takes a lot to figure out what's going on with somebody. I would spend an hour and a half visiting with you to get a full history before I would design specific things for you, okay? So my advice that I'm about ready to give you is limited by the brief explanation that you've been able to give here, okay? All right, so number one, in terms of rickettsia, if you're on a tetracycline like doxycycline, tetracycline, or minocycline for at least a month, the odds are you took care of those. Rickettsia is actually pretty easy to take care of, probably is not chronic. And I would suspect if you've been treated for 5 years, somewhere along the way, somebody put you on a month of a tetracycline. I would suspect, okay? If not, somebody should put you on a month of a tetracycline, okay? All right, that would probably take care of rickettsia, and I believe that is what you would use to take care of the typhus, marine typhus as well too, although that one I have to look up. I don't know that one off the top of my head, all right? All right, in terms of treatment for Bartonella, rifampin coupled with azithromycin is a good treatment. Doesn't mean it works in everyone, right? And so if you've been on it for at least a couple months, and if you are still having symptoms suggestive of Bartonella, like pain on the soles of the feet, anxiety, depression, tremors, shakes, numbness, sharp shooting, stabbing pain, neuropathy, severe cognitive impairment, if you're having all those things still, then you got to wonder, is it working? Okay. And if it's not working, then you may want to change to 2 other antibiotics. All right. In addition, your treatment of Bartonella could be improved by adding something that goes after the persister form of Bartonella. So your azithromycin rifampin is only adequate against growing Bartonella, but those are not adequate treatments for persister hibernating forms of Bartonella. And adding in a liposomal oregano or a liposomal cinnamon clove oregano, 1 pill twice a day, could help you get at the persister components, and in addition could also help you remove biofilm slime layers that are blocking the treatment as well too. Okay, all right. And then one thing I do want you to know, I think you may know it, disulfiram is not a Bartonella treatment. Disulfiram may be a Lyme treatment, but disulfiram is not going to be a Bartonella treatment. So your Bartonella treatment for what you've written here is your azithromycin and your rifampin. Okay? All right. Good luck to you, Anna. Hello, Nancy. Let's see. Have you ever used 200 milligrams of fluconazole daily for 2 months? Is it better to use 200 milligrams once daily or 100 milligrams twice daily? So yes, I have used 200 milligrams of fluconazole daily for months. I've actually done it for up to 6 months with people For yeast, I often will use it up to 2 months if I need to. I sometimes will use fluconazole, though, as an anti-cyst agent. As I explained earlier tonight, it may have some ability to do that. And that kind of situation, I've used it up to 6 months without any problem with people before. I tend to have people take it all as one time a day. I frankly don't know if it would, I don't think there would be any harm in taking it as 100 milligrams twice a day. I think it would probably still work as well. But for ease of using it, I just have people take a 200 milligram pill one time a day. Okay? All right. Good luck. Hello, Joyce. Let's hear Dr. Ross. Hope your headache last week was short-lived. It was. Thank you. I appreciate that. Since wildcraft herb Sida Houttuynia is no longer available, please review the new Sida product in your store. Is this also Sida Houttuynia or a different Sida? And what are the different types, and do they treat Bartonella the same way? Are they equally effective? Okay, so first of all, and this is based on Stephen Buhner. So Stephen Buhner, as you know, is a master herbalist, right, who writes about this. And if in looking at his Bartonella book, what does he call his Bartonella book? Hold on here just a minute. Yeah. This one. Okay, this book by Stephen Buhner. He's got a section in here that talks about Sida. And so Sida, there's varieties of Sida. There's Sida Houttuynia, there's Sida cordophila, and there's one or two other varieties too. And he considers them to be fairly interchangeable because the active chemical in all of those Sidas is the same. That is your antimicrobial chemical, okay? And so Sida Houttuynia is interchangeable with Sida cordophila. Sida cordophila is what I have on my store at this time, okay? Notice the word I said at this time. I'll say more about that here in a minute. So the company that I'm using is a company called Elk Mountain Herbs, which is, and Stephen Buhner in his various books gives you resources, okay? And where he makes recommendations about where you can get the herbs and from high quality producers that he trusts. And one of those is Elk Mountain Herbs. That's how I came upon them. They happen to allow wholesale accounts, which means I can resell their products, okay? So they don't have Sida Houttuynia, but they have the Sida cordophila. And then based on my research, seeing what Stephen Buhner has written, I consider the two to be interchangeable. Okay, all right. So that's why I'm carrying that. Okay, now here's the hitch. So I offered it, and I had stockpiled quite a bit. And somebody yesterday bought practically all my bottles. Practically, I mean, a huge order. I think they ordered about 40 of them, which is unheard of. I mean, I set up my store for the average, not for something like that. Okay, so I went back to Elk Mountain Herbs, and guess what? Their supplier of the plant is on back order right now. So I probably have about 12 bottles left now, and that's it. And then I'm going to be out probably for a few weeks. So in my absence of having Elk Mountain Herbs products available, what I would suggest is the other company out there that I trust, and I would carry them if they gave wholesale accounts, but they don't, is a company out east called Woodland Essence. Woodland Essence has a Sida Houttuynia product, okay? And so that's what I'll be directing my patients to do until Elk Mountain Herbs gets their supply back in of plant and creates new tinctures for us, which could be as early as next week, but I don't know. I may be out of it for a few weeks here, okay? All right, so they are interchangeable. Sida cordophila, Sida Houttuynia, same active chemicals, interchangeable, okay? All right. All right, let's see. Number 2, next month marks 20 years diagnosed with Lyme, Bartonella, and Babesia. In 2015, I started getting tiny, blistery, painful pimples all over my right foot only. Over a few weeks, they erupt and dry out, scab over. Sometimes I don't get any for weeks, and then I get an outbreak. I shower daily and use every natural soaps and creams. I was told this is Bart. Does this sound familiar? Thanks, as always. That is not, I haven't seen that happen in Bartonella. And it's one of those things, skin is hard to diagnose by a description. It's better to see it, okay? What I wonder, though, is if you've just got some kind of recurrent fungal infection, because some fungal infections will give you blistery type rashes like that as well, too. It's something I would need to see to actually be able to give you the best recommendation, because I can't tell just by a description what it is, okay? All right, sorry about that. But no, I would not think of that as being something that is necessarily Bartonella, okay? All right, good luck to you, Joyce. All right, let's see here. Hello, Crystal. Love your shirt, Dr. Ross. I like this shirt too. This is my skull shirt. Okay, now keep in mind before everyone starts thinking skulls mean death. Remember, out of death is rebirth. Okay, so this is my rebirth shirt. All right, so I appreciate that. Thank you. All right, let's see here. And then one more question here. This is from Lynn. Is there a good test for leaky gut? So there is a test that you can do called zonulin. Zonulin is a protein that is found in those gaps. So in these gaps, one of the things that's found in here is a protein called zonulin. And if you've got leaky gut, you can have antibodies against the zonulin. So there are some companies that will do zonulin antibody testing. If it is elevated, yeah, it probably means you have leaky gut. But in terms of it always telling if you have leaky gut, it's not 100% accurate. Okay? All right. Good luck to you, Lynn. All right. Everyone, believe it or not, I went through every question tonight. I think I did. I see one here from Kate, but it looks like I answered that one earlier. And then Christine says, thank you. Interesting stuff I don't know about today, or I didn't know about today. I don't know what you didn't know, Christine, but anyhow, I'm glad you're here. So listen, everyone, tonight I will be doing tomorrow morning, I'll be doing an edit on the video recording. And my plan is to have it ready between 9 and 9:30 in the morning. And then yeah, so that's what, look for that. Okay, so in the morning, you'll see an email come out from me saying that the recording is ready. All right. When you get that, look at that email. There'll be a link that you can use to sign up for the webinar next week. All right. And I want to recruit all of you to help me spread the word. And I recruit you to actually, I challenge you, actually. I challenge each and every one of you to send out a copy of the email to anyone you would know that would benefit from hearing the recording of today's webinar, but also that would benefit from future webinars as well, too. Help me to reach as many people as I possibly can. Okay? All right? Good night, everyone, and I look forward to seeing you all next week. Bye-bye.